Clinical examination of the heart. Auscultation of the heart. The heart sounds are associated with the opening and closure of the heart valves. Use the bell of the stethoscope for low-pitched sounds at the apex of the heart, and the diaphragm of the stethoscope for high-pitched sounds at the base of the heart. First, listen at the mitral area with the bell of the stethoscope and listen for the first and second heart sounds. The mitral area in the normal is the fifth left intercostal area in the mid-clavicular line. One can determine which is the first heart sound by timing the heart sounds with the carotid pulse. Place the left thumb on the right side of the neck. The pulse one feels is the carotid pulse. The first heart sound coincides with the carotid pulse, and the second heart sound follows. The first heart sound is due to the closure of the mitral and the tricuspid valves at the beginning of systole. The second heart sound is due to the closure of the aortic and pulmonary valves. In the young, the second heart sound is usually single on expiration, but inspiration delays pulmonary closure as blood is sucked into the chest. The right ventricle output is increased. The doubling of the second heart sound on inspiration is lost with increasing age. After satisfying oneself with the presence and character of the first and second heart sounds, one must listen for the third and fourth heart sounds if present. The third heart sound follows the second heart sound, and the fourth heart sound precedes the first heart sound. The third heart sound is associated with ventricular filling and is heard soon after the second heart sound. It is dull and low-pitched and is nearly always localized to the cardiac apex. A soft third heart sound may be normal, especially in young people, but in older patients, is usually an indication of constrictive pericarditis or pericardial effusion. The fourth heart sound is associated with atrial contraction and therefore occurs at the end of diastolic just before the first heart sound. When audible, it is always pathological and indicates heart failure. Like the third heart sound, it is low-pitched and is localized to the cardiac apex.